Let's kick it off. Well, welcome everyone, and thank you so much for coming to our event tonight. We are here with an expert panel of thought leaders and experts and specialists in their field. We also have some wonderful athletes who have so much experience working in the area, but also experience going to the Olympics, training and working towards building their performance. So I would really love to introduce you first of all to the panelists, and if each of the panelists can give a brief background of who they are, where they fit into the space, and we'll go from there. So Maddie, I'll kick it off with you.
Hi everyone, my name's Maddie Groves. I'm an Olympic swimmer from Brisbane and I have endometriosis and adenomyosis.
Thank you. Mon, welcome.
Hi everyone, I'm a Paralympic swimmer and I have adenomyosis and endometriosis. So I've been navigating that for the last 5 years and was brought into this group through Maddie Groves. So it's lovely to be here to share some wisdom.
Fantastic. Alex, welcome.
Hi everyone, I'm Alex Diggles. I'm a pelvic health physio based in Brisbane. I've worked in pelvic pain for a little while, so I see a lot of patients with endo and adeno and really interested in how we bridge the gap from telling people to do nothing to trying to influence that they can be as active and healthy as we can possibly make them.
Fantastic. Kiah.
Don't worry, everyone gets my name wrong. So hey everyone, I'm Kiah Paetz. I'm a dietitian and nutritionist from Brisbane. I also have endometriosis and adenomyosis myself, and I work alongside Dr. Graham Tronc as part of his team of endo consultants, or helps his patients with their diet. And kind of my passion is, helping people with endo and adeno about how their diet can help manage their condition, whether it's reducing overall inflammation or helping with bowel symptoms.
Fantastic, welcome. And Kellie, welcome.
Hello, I'm Kellie Hogan. I'm also a dietitian and have been working as a sports dietitian for about 20 years and predominantly working with male sport athletes up until the last 2 or 3 years, which very soon after I met Mon and subsequently Maddie, and have done a little bit more and more work in this space. My background is also I have endometriosis as well.
Thank you, Kellie, and welcome, Bron.
Hi everyone, my name is Bron Knox. I'm an Olympic athlete in the sport of water polo. I had my surgery and my diagnosis of endo in 2017, and I wish I had done it so much earlier than when I actually got round to doing it. I think it was just, the worry of what the other side was going to look like. So for me, that's the reason why I'm here, and I think it's so great to have a platform like this to start this conversation and continue this momentum.
Absolutely, Bron, and I think you've touched on some fantastic points there that we hope to get into in this session. And thank you. And Belle, welcome to the panel.
Hey everyone, my name is Belle Brockhoff. I am a snowboarder and I've been brought in by Mon Murphy, so really excited to be here and actually willing to learn a lot of things about female bodies that I may not even know, and also add some information on how menstrual cycles have affected my body and may have led or increases the chance that I had with my ACL blowouts a couple of years ago. So yeah, happy to be here.
Absolutely. And last but certainly not least, we have Dr. Graham Tronc. Welcome, Graham.
Thanks, Jess. So I'm a gynaecologist from Brisbane. I've got a special interest in endo and adeno, obviously. More so since meeting my partner, Fiona, 8 years ago. And even more so with regard to young women and young sportswomen after treating at least a couple of the panel here myself. And my special interest is really to make the diagnosis earlier or as early as possible.
Absolutely. And we know, and we've seen over the last few years, particularly with endometriosis, there has been a heightened, I guess, spotlight put on the condition, and we're seeing loads of people come forth considering or thinking they may have the disease. And so to pair that, what do we do about it? And certainly over the last number of years, Maddie and Mon and I have connected to really discuss this. So tonight we are here to talk about our bodies, talk about female health, and how this applies to if you are considering or working towards the Olympics or the Paralympics. And we have a wonderful group of people here, not only on the panel, but we have coaches, we have parents, and we have women as well who are in the audience tonight. So I'd like to thank you all for your time and your interest, and welcome. So first of all, I think we need to get some ground rules straight, and we need to understand what our body is, because, you know, even as a female, we often don't really know the anatomy a lot of the time, or we don't know what a period is. So Graham, if you can kick it off with giving us some basics and some foundations of what is a period, what's normal and what's not normal.
Sure, okay. So look, I'm going to keep the anatomy pretty simple. So the female anatomy involves a uterus, which is the organ which contracts to push babies out. That's its primary function. It also contracts every month in a normal menstrual cycle to rid the body of the endometrium, which is the tissue to which an embryo will grow. So below the uterus is the cervix, or the cervix is actually part of the uterus, and then below that's the vagina. Coming from the top of the uterus, and again I'm being pretty simple, the fallopian tubes, and they're just a pipe which connects the egg and sperm. In other words, egg and sperm need to connect, and fertilization happens in the fallopian tube. And then of course you've got the ovaries, and the ovaries are about the size of an almond. And until the first period, they're pretty small, and then they get bigger as menstruation continues. I think I'll leave it at that, because I think most people will know that. So what happens is that with the first period, and the age can vary. Like I've got patients that have had their first periods at 8. I don't think I've had anyone at 7, but 8 until 16. Right, so 8's very early, 16's getting on the late stage. What happens is that at some point in time, the pituitary gland in your head there, sends out messages to the ovary by way of a hormone called follicle stimulating hormone, FSH, to say to a little tribe of potential eggs, ovary, we want one of your potential eggs to become the egg follicle for the month. So you make a normal cyst, which is about 2.5 centimeters in diameter, filled with clear fluid, in which there is also an egg growing. In the first half of the cycle, in other words, the first 14 days of a normal, in inverted commas, 28-day cycle, estrogen is made. So estrogen is the female hormone, and that goes through the bloodstream from the ovary and stimulates the inside lining of the womb, in other words, the endometrium, from which the word endometriosis comes. Mid-cycle, ovulation happens, the egg is released and goes and waits in the tube for sperm. That's not the end of the egg and estrogen factory. That factory then becomes an estrogen and progesterone factory. So that, and I describe progesterone as a bit like the fertilizer on the garden bed of the endometrium. In other words, nature's trying to make an environment suitable for an embryo to grow in. So second half of the cycle, you've got estrogen and progesterone building up the lining of the womb. Now, if that egg is not fertilized, then women have a period. Very often I see patients who, from the very start, their periods are painful. Now, painful enough to need more than Panadol, take time off school, not be able to go out socially, suffer extreme bloating, painful urination, painful bowels, and the list goes on. So if that happens with the first period, alarm bells should ring at some point down the track, hopefully not too long down the track. Almost every week, I get a patient that sees me who's 30-something saying, oh, thank God you've listened to me. I've been to XYZ number of doctors and no one has actually listened to what I've been telling them, which is sad. And they sometimes have tears in their eyes, which means people aren't paying attention to what is normal and what is not a normal period. So endometriosis is a condition where the lining of the womb, which sheds through the vagina, grows outside the uterus, but usually inside the pelvic cavity, but certainly sometimes within the abdominal cavity and occasionally elsewhere in the body. But I want to focus on endometrium going in the pelvis. Is this what you want, Jess? Like something simple like this?
Sure.
Yeah, okay. So, like, because some people may not know this, you do, and the panel might, but the general public mightn't. So anyway, so endometriosis is the lining of the womb growing outside, and if you imagine like little blood blisters of endometrium or little bits of endometrium bleeding inside the pelvis, they're a bit like painful blood blisters that are happening every month to a young woman. Sometimes people's first periods aren't painful. They're fine for the first 2 or 3 or 4 or 5 years, and then something happens. Maybe it's an immune system compromise where their immune system can't get on top of the little bits of endometriosis that are happening, and they get more pain, right? So that's a very variable thing. But that should be the trigger for mothers or coaches or boyfriends or fathers or someone to take that young person to a GP. My problem is that that sometimes happens, and the GP says it's normal, or maybe it doesn't happen. Maybe mum says it happened to me, therefore it's normal, or the teachers say go to the sick room, but you know nothing's really done, or they go to the GP and they say it's normal, or go on the pill, or put up with it, or it's in your head. It's not in your head, it's in your pelvis, etc., etc. So that's endometriosis. Now, there is another condition which is really underdiagnosed in teenagers and young women too, and Maddie and Mon both mentioned that they have adenomyosis. So that's a condition that often goes hand in hand with endometriosis, and that is a condition where the lining of the womb grows into the muscle of the womb. So if you imagine miniature corked leg type lesions inside a uterus, like if you're a footballer, you get a corked leg, it hurts for a week. If you're a woman having a period and you got a period into the bleeding into the muscle, it hurts every single cycle. So some people have got endo, some people have got adenomyosis, some people have got both. So this is a forum on young female athletes wanting to do their very best, and a system in Australia which is really failing them on multiple levels. Sometimes on a family level, or at a family level, sometimes at a doctor level, GP, sometimes at a specialist level, sometimes at a professorial level. And I won't mention names, but there are 2 paediatric gynecology professors in Australia that I would love to give some figures to say, and quote me, adenomyosis does occur in teenagers. Read my book, okay? So I'm going to leave out PCOS because PCOS it does exist, it certainly exists. Polycystic ovaries certainly exist in teenagers, in athletes and teenagers, but the syndrome bit, the PCOS, is often overdiagnosed by radiologists who put on the reports, you know, that the ovaries have multiple little follicles and therefore they've got PCOS. The S is a syndrome, and most of the people don't have the syndrome. So I'm just going to leave that sideways because it's another whole book you could write. So if you talk about now most of the female athletes are going to be young, right? Then most of them don't start athletic careers in their 30s. They probably started in their teenage years. So here's a group of relatively young women who have great great skills, whose skills are sometimes compromised by the fact that they've got pain and the pain has not been diagnosed. So I personally think that if a young woman that goes along to the GP with recurrent period pain that is needing more than fairly simple analgesics, hot water bottles, curling up in the shower, vomiting in the shower, going pale with the periods, that's not normal. So those people should be offered a laparoscopy. And there's other symptoms too, pain when you move your bowels, etc., etc. They should be offered a laparoscopy. Now, not all specialists will say that. Some will say, oh, just put them on the pill. And I know from looking at various sports sites, let's say, that often female athletes are told to get on a pill so that they can control their menstrual cycle, like the FSH, sending messages to the ovary, to get on the pill to control their menstrual cycles. Now, that's fine, and it will control the menstrual cycle in a normal person that hasn't got extra endometrium somewhere. My way of describing it to patients is that if you are a normal person and just has endometrium, which is endometrium in the lining of the womb, and doesn't have extra endometrium outside the womb, and doesn't have endometrium in the muscle of the womb, sure, the pill's it'll control your periods. You can go on the pill month after month after month safely and not actually have a period. But if you've got 3 target tissue, 3 lots of endometrium, or at least 2, endometrium and endometriosis, plus or minus the adenomyosis endometrium, the pill's not going to work, because the dose of the pill in pretty much every single type of pill, very similar, and there's just not enough hormone in it to suppress all 3 target sites. So what happens? They bleed, right? They have odd menstrual bleeding despite being on the pill, which is supposed to control their menstruation. And usually when people have endometriosis and adenomyosis, they bleed, they'll get pain, all right? So if we can control the bleeding, then we can control the pain. So unless we see and diagnose what we're treating laparoscopically, because you can't see it on scan until it's too late, then the pill is not really the most helpful thing to do first up, I don't think. You will find other gynecologists that say different, like put them on the pill, see what happens, give it a trial. My opinion is that you're masking the endometriosis sometimes for years and years and years, and perhaps telling these people that it's normal when it's not normal, and that we're trying to treat with a pill what? We haven't got a diagnosis. That's my major gripe about what's happening today. So is this still on the right kind of track?
Yeah, great. So what you're saying is what here at QENDO, we like to call it a toolbox, and everyone needs to consider what their values are, what their health and personal values are. And then we really encourage them to go along their life, picking up different pieces of information from different people, aligning it to what suits them or what sits right for them, and then making that judgment call. Yep. And so, a lot of what you've suggested then, they're different options for people to talk to their doctor about.
Yeah. Provided their doctor knows about endometriosis and talks about endometriosis, because a lot of time they don't. And therein lies the problem, as you know. So people can go round circles, and they're put on the pill or something else, or an implant on, or have a merino stuck in before they even know what's being treated. Personal view, but I think it's an important one. Now, I'll just have a few other notes here. So, do you want to leave it there and
let's leave it there, and I'm really keen to get to hear from somewhat of the athletes say. So we're talking, endometriosis is endometrial-like tissue that can be found in other parts of the pelvic cavity, and there's loads of symptoms that can come in. Pain is one of them. Bloating, there might be some painful intercourse, pain on urination, bowel, and there's a whole heap of different things. To our athletes here that have diagnosed endometriosis, what were your symptoms? So I'll head with Maddie first, if you are comfortable sharing.
Of course. I would say I think my symptoms started with my first period, really, when I was 13, and I just never knew, or it was never talked about at school, about what a normal period looked like and what wasn't normal. And so I you know, sort of suffered over the years. My condition got worse and worse, so it sort of as different life stresses occurred, and until my pain was so bad at the end of November 2017, I actually thought my appendix was exploding. But thankfully, I have a very responsible GP that pointed me in Dr. Tronc's direction, and I've been looked after by him, and of course QENDO ever since. So I had a lot of, really my symptoms were like pain, worsening pain over time, very heavy bleeding, and fatigue. Really, fatigue was something that really marred you know, my whole career. And I had so many tests, and you know, testing me for glandular fever and low iron, and trying to figure out what was wrong with me, but all, you know, different blood tests. But of course, all those things were clear because an endometriosis won't show up on a blood test or anything. And, you know, I passed all the medical screenings that there are to be passed in swimming. But, you know, apparently this fatigue was just all in my head. So I was very relieved to finally get a diagnosis. And that's sort of what has motivated us to want to have a discussion like this, just so that people actually are educated on what are normal symptoms and what aren't normal for a period. So yeah, hopefully people can get help sooner.
Yeah. And I mean, I'm not an athlete at all, but you guys work so hard all the time, and it's your career to perform and to work at achieving those goals that you set out for yourself. And that fatigue must have been really tricky to come to terms with, just realizing it is something.
It was really tough. You know, I don't think people realize, like, I actually probably didn't do a full week of training at all before the Olympics because of this fatigue and this illness. And I was certainly chastised by like everyone around me and the people in my squad, thinking I was just lazy for having extra sleep-ins and taking time off. And you sort of are, you know, put in a corner for not sort of working as hard as everyone else, when really I was just really struggling to make it through every day. And so yeah, it really did affect me a lot. And I think there is this misconception where it's like, oh, if someone's not turning up to training, they're like lazy or trying to get out of it. But, you know, trust me, if people, you know, if like a young, fit, healthy person can't turn up to training every day, it's like there's probably a reason why. It's not just, you know, lazy. It's like, sport's great, but you can just, if you just didn't want to turn up every day, you can just quit and do something else.
Yeah, you don't get up basically at 3 a.m. because you like it, right?
Yeah, exactly.
Bron, I'm really keen to hear your experience. What were your symptoms, and when did they start?
So my symptoms started a little bit later. It wasn't with my first period. It was sort of around, I don't know, 19, 20, I think, where I started getting more pain, started getting really nauseous. My bleeding got so much heavier. Like it got to the point where I'd seek out external pain stimulus to take away the internal pain stimulus, because I couldn't stand up properly. I was extremely bloated. I barely left the house because I didn't trust any of the precautions like that I put in place, that I'd be out somewhere and I'd have to rush to the bathroom because I knew that I was bleeding through what I had put in place. And it ruled my life. Like it ruled it. It was something I dreaded every month, that I'd set an alarm and start a week of preloading painkillers to get that sort of residual level there. So when it did happen, it wasn't a surprise, because I couldn't sleep. I would get night sweats. I'd wake up drenched, like feverish. It really ruled my life. Like it made me change a lot of my decisions, because I didn't know where to turn, because everywhere I did turn, it was, well, this is normal. Everyone goes through it. It wasn't until I actually brought in like photo evidence, when they just said, oh, that's just heavy bleeding. I said, well, what is this? And they're like, oh, that's tissue. I said, thank you, because like I know what blood clots look like, and that is not a blood clot. And it only lasted probably 3 days max. but it was the worst 3 days, and I'd spend about 2 weeks worrying about it and stressing about it. And it took a long time to sort of get the help I needed. And being in a water sport, you're in your swimmers a lot of the time. And for us, like, it's not like one race and you're done. You sort of sit around, you sit on the bench, you sit on the side of the pool, and you know, there's been so many times where people have to go, oh, you might need to go to the bathroom, because where you're sitting, because once you add water, it just becomes, I'm sure everyone knows. So that, like, for me, it really, you wouldn't get out of the water, because you knew as soon as you did, you'd have to grab your stuff and go straight to the bathroom, because you wouldn't last more than 5 seconds. And if someone stopped you on the way, you're like, please, no one stop me, because I just need to get to the bathroom.
Yeah, absolutely. And it's a lot of the time it's really interesting that yours started a little bit later, and we do know that the amount of disease doesn't always correlate to the amount of pain, and that's a really important thing to take away from this as well. And you know, pain isn't always a symptom. You know, if you have stage 1 disease, you might be in a world of pain, or if you have stage 4, you might not even know it. And so there is a big difference, and there's so much research to be done there. Maddie, tell us about your story, because yours was later in life too, after a traumatic experience.
Yeah, so looking back when I was in high school and had my period, I do remember having some more painful periods, and I remember Mum just taking me down to the pharmacy to see what they had for period pain, and it wasn't even a thought that you'd go to a doctor specifically for that. I remember being so keen to race the first time I had my period, and I used a tampon and I couldn't get it out afterwards. I think my body was just not ready for that. And then I got very angry when my dad told my coach that I had my period, because I'm pretty sure he'd worked it out, but I was still humiliated because it wasn't something that was talked about. And then in 2014, I was 19 years old and I had a very serious accident. I fell from a balcony and ultimately had my right leg amputated below the knee. From that is sort of where we think that my endometriosis really kicked in. From there, I had quite a few really painful periods initially after that accident. And then I didn't have a period for about 2 years, which was great, until it decided to come and surprise me a week before we left for the Rio Paralympic Games, which is like the worst timing ever. And that's really, from there, that's when all the symptoms kicked into high gear. The pain was definitely there, but as somebody who has phantom limb pain as a result of an amputation, my perception of pain is quite skewed. And for me, that sort of belly ache and pain didn't really match some of the other major surgeries and things that I'd recently had done. So the fatigue was what really got me. And despite having won a silver medal in Rio and knowing what that training looked like since Rio, I just felt like maybe this is what being an athlete is. Maybe we're meant to be this tired, maybe it's meant to be this difficult, and maybe I just don't have what it takes anymore. And I saw 14 doctors in specific relation to my period before I asked to see a specialist, and thankfully I was pointed in Graham Tronc's direction. So, you know, if you are out there having difficulties, having symptoms, it's, you know, you should be brave enough to believe in what you're experiencing, and keep finding someone who will listen, or go to the QENDO resources. But what shocked me the most was when I saw Graham. He asked me about my period, as you know, through my time to that point, and I couldn't really think of the answers that he was looking for, because it wasn't something I'd taken into consideration. In sport, it was sort of something you just had to push through and was really often ignored. It wasn't something that coaches had talked to me about, and they weren't looking for a way to work with a female athlete. And it's really something so crucial, even if you're not experiencing pain or the fatigue or the symptoms that some of us here today have, because just understanding how your body works and how to work with the ups and downs of it is what's really going to help you achieve those successes in sport. And that's where I've reached out to Belle, because when we were just having a chat, she's got such a great knowledge of her own cycle, and then it absolutely comes into play through competition and training. And it's what you really be able to reach those heights, because you don't know where your body's going to be on race day. And once you're at that Paralympics or Olympics, nothing's going to stop you from getting up behind the blocks. So you've got to know how to work with your body on any given day.
That's a great segue there. Thanks, Mon. Belle, you're up. Tell us about your cycle and how you work with it against your performance.
Okay, so all that I've just heard is pretty gnarly stuff, and I don't have that, thankfully. Well, so for people who don't know me, so I'm a snowboarder. I've been doing it most of my life, and I've just come back from 2 ACL blowouts, which is just, you know, it sucks, but it's just what it is. Injury happens in sport. And each time I did my knee, I had my period, and during my period, my body, it feels looser and fatigued, and I hopped on the pill after, I guess, some time, and decided to control my menstrual cycle, just because when you're at the snow, it's -30. You don't want to mess around with those kinds of things. You just want to get your stuff done. But regardless of that, I still felt fatigued and lax, and my focus wasn't great. So when I made the links with my period being the same day in the cycle, so the 3rd day of my period, I did my first knee and then came back and did my knee again. I decided to just kind of look at my training blocks from that and time it with my menstrual cycle. So we'll train 3 weeks on and then take the 3rd week easy. In the gym, it's a little bit easier for me because I can push myself quite hard, and still, even on the week that I have my period, I can still, you know, somewhat push hard, but also bring it back if I need to, and it's more controllable. But when it's, you know, when you're in your sport, you're competing at a World Cup, especially with winter sports, there's so many like external elements that you're dealing with, you know, visibility, snow conditions, wind, the snow texture. In my sport, we've got 3 to 5 other athletes around you, so you've got all that like distractions around you while you're trying to do your thing. Last thing you want is to come in fatigued and feeling like crap. Period pains are sometimes really severe for me. Nothing like what some of the girls have, but it does affect my performance, which is why I hop on the pill, just to kind of control it a bit better.
Really interesting, completely different perspective there, Belle. Thank you so much. I noticed Alex's eyes raise a little bit when you mentioned around your injury on your pill. Alex, you are a pelvic floor physio, and you've worked with loads of people with pelvic issues before. Can you give us some information or some strategies if someone is feeling or finding themselves quite tense or having some cramps around that time, some strategies to use in their toolbox?
Yeah, great. Thanks, Jess. So definitely, I think everything resonates with what the girls have already said, and Graham, but we do see that, particularly if I focus on female athletes, that there is elements that the female athlete will have more issues with pelvic floor dysfunction, and we've got really good studies based on that. What we are missing is the studies on how to manage injuries, including ACL and groin injuries, because they're really not focused on too much in the research yet, but they are being done, which is the good news. So as a pelvic floor physio, I just wanted to take back a step and even just explain how common that they are in sport. That if we took a athlete, let's say 24 years old, and compared their risk of incontinence, which is bladder leakage, to someone who's not an athlete, they're 2.7 times more likely to have problems with bladder incontinence. We know that 54% of athletes will have at least one urinary symptom, and that's not just leakage, but that's urgency or problems with voiding properly, and that all occur in 45% of people that either are during their sport, but also just in daily life. Now, this is just general data that we have, and that's a significant amount of athletes, 54%, that will have some level of pelvic floor dysfunction. And we're not even talking when we put into the mix that 1 in 10 women may have endometriosis as well. So of course, there's going to be a huge element where pelvic floor comes to an issue. I loved that Belle brought up the fact that ACLs are probably the best research part of women in sport, and that they're more common in women than men. And I'm probably going down the path a little bit of pain and prejudice as far as that we know a bit about this, but we are seeing that there's differences in men and women when it comes to sport as well. So the question that I always propose is that, well, we've got to look at each person individually, because the symptoms are quite can be quite significant. We're talking pain, we're talking bladder dysfunction, bowel dysfunction, but physiotherapy is quite broad, and it often needs a team approach for the team that you're in. And as a pelvic floor physio, I'm looking to make sure the muscles work as well as they can. So often the focus on pelvic floor is that, oh, if I have leakage, I must be weak, so I'm going to ramp them up and see if I can control them really well. What we see is, well studied so far, is that elite athletes don't have weak muscles, which doesn't really fit, that they're actually leaking for other reasons. And that could be tissue distension, so the actual tissue moves a lot more. Their timing can be off, and that can occur because of pain and different muscles moving. And their actual coordination and endurance may be different, and that's affected by pain, but also the high impact loads that we're putting through. So when you look at what a pelvic floor physio might do, it's actually looking at how do these muscles work well, and why might they not be performing to their best. And I can imagine that any athlete hasn't actually thought about whether their pelvic floor is working to its potential. You know, we focus on quad strength and landing ability, maybe not in swimming landing ability, but shoulder range of motion. But definitely the pelvic floor is a muscle group that actually controls lots of different organs, and we need to make sure that we're working, that it's doing all of the things it should. If we put the complexities of pain on top of it, 90% of women with endometriosis have been shown to have pelvic floor dysfunction. So that's quite an amount. And what we usually see with that is that the muscles are shortened, they don't move as well, and they actually have poor endurance. So if we're then adding higher loads to this, or training loads, that they're not going to be at their peak performance, and it might actually affect them in that way. With Jess's questions, which I am getting to, Jess, sorry, I love this topic, but we do know that we can look at doing release techniques, which I guess because of where these muscles are, I get a special job, but they're no different as far as that they can be lengthened, they can be shown how to time better, we can work on endurance, and really we know the pelvic floor has to be reflexive. It turns on before jumping, it turns on before heel strike, or before throwing in water polo, because they need to be that stability around the pelvis to give them support. So I do actually need to progress just from, you know, basic activation to coordinated in high impact loads. So if you think about releasing for your shoulder and timing and strength work, we do all of that as well.
Alex, you don't have your active gear on tonight. You usually do. Do you have any strategies or suggestions, or even just one tip to help with that people can be doing if they're in a flare? What can they do?
So in a flare, and I think if we take the example that a lot of people have flares around their period, that they can have them mid-cycle as well. And I think what we see is that there's this increase in inflammation, particularly at that point of a bleed at the end of a cycle, that often we end up with a lot of tension and a lot of edgy nervous system. And what I mean by that is everything's just firing and going off. So we get the bloating and the urinary frequency, and the muscles become tense because of a lot of that. But at that point in time, you can pick maybe slower based exercise. Now, I completely agree. I'm not a coach, but we definitely can work with coaches. And as Belle's already pointed out, maybe that's the time where motor control might not be as good. So in that bleed phase or in that pain phase, that we can pick more of a focus on flexibility. So it could be a stretch routine, particularly focusing on your sport, but maybe around the pelvis. So your child pose stretches, your adductor stretches, your lower back stretches, as well as things that allow the pelvic floor to move without high load. Now, in some people, load can actually, or intensive exercise might help with pain, but generally we'd see that's ramping then the pelvic floor into that shortened state. So I would pick things during a flare that work more on maybe flexibility and motor control rather than the high intense training times that you want to do at that point.
So what if someone is in the stage where they, and I'm not an athlete, like I keep nodding my head, but I'm just going, yes, this is great info. I won't use it because I'm not an athlete. But let's just pretend I am, and I am flaring, and I have a lot of pressure from my coaches and my team to continue pushing through. Do you have any suggestion for someone who might be feeling or in that situation?
Oh, it's a big question because, you know, my first thing is we want better advocacy, that we aren't just saying we don't talk about this. And I completely agree with Mon. As a 12 or 13-year-old, the last thing you want to do is talk about your period with your dad there. But I think that we need coaches to be on board, and it's really good if you can say, hey, do you know the Chelsea football women's team uses their menstrual cycle to plan their exercise? How about we look at that for me? And, you know, as far as a pain flare, that it can be that if you're picking something else that's useful for your training, that might involve the things that you know don't flare you. So if you're doing high impact work and your coach is still giving you other options, then maybe we pick the other options instead. And I don't think this can be done with just your physio. I think it's with that team approach. But I think the coach needs to be involved in these decisions. And I'm not a sports physio. They really focus on the types of sports and working it out. But definitely it's a discussion I've had with plenty of coaches that we go, well, what can we do that might help us with timing or other activities or technique rather than the high impact at that point in time. So I think that answered your question, Jess, that we do need the coaches on board. When I was researching for this, there is an app that is nowhere as good as the QENDO one, but there's another app called Fit Woman. And it was used just to promote the idea that you can track your menstrual cycle with your exercise training. And it's in one app. So I think that was a good mix, that it just opens the conversation that coaches should be aware that there is some evidence. Now, it's not great, but we do see higher risks of ACL injuries actually in mid-cycle around ovulation. And there's mixed studies that show that their injury rates will vary throughout the cycle. So it only is of benefit to the athlete to actually put that in place.
Fantastic. Thank you, Alex. Do any of the athletes here online have any comments or anecdotes? Mon, go for it.
I would say that it's a lot about communication, and it's definitely from both sides, the athlete and the coach. I've recently just moved to a new coach because I didn't feel like I was getting the support that I needed. And this new coach, he sat down with me for almost 2 hours and let me just download everything that I'd been experiencing. And it was a way to sort of say, I don't even know what my body's going to do tomorrow or the next week or the next month. But if it looks like my training is lacking, look at my effort, don't look at my times. And was just trying to find a way that I could communicate it to him, because I think all our current coaches on the Olympic and Paralympic swim team are men. So we've got to understand they might have the education that we would like them to, and they definitely don't have the life experience. But just finding a way to tie it into their language. And it definitely takes a little bit of work for younger athletes out there, whether you want to bring a parent to the conversation as well, so you can feel more supported. But it is, when you cross that line and you can talk about these things with your coach, it's a whole new world. And you're like, wow, I can go training and feel shit, and my coach will adjust a session for me, or they'll work with me so I don't have to stay home and miss out completely, or they'll just be there for you when you are ready to come back. So it's well worth the effort, but it is definitely a work in process. So keep working at it.
Fantastic.
Yes, if I just add, I had an idea that, you know, if we're setting up athletes and they're assessing other muscle groups, and there's no reason we couldn't actually look at their strength and their times across their cycle, and we could actually work out sort of roughly ovulation. There's, you know, there's urine dipsticks for that. We could look at a calendar time, and if needed, and it depends on, I guess, the funding and other structures around it, but you could also do a blood test to look at the serum levels throughout the cycle and actually work out each individual's performance and whether it does affect them or not. Because the research shows that it does affect, but we're inconsistent in our evidence at the moment. But each coach could track that with each athlete, and that's only going to be empowering that they know their body better too.
Yeah, absolutely. It's really a big advocacy piece, working with your own self, you know, really knowing your body and then communicating that to a coach. Maddie, what's your experience?
Yes, well, I've had a lot of experience with trying to communicate with different coaches and support staff around swimming about how I'm feeling, and I moved to train with my current coach, David Lush, at Moreton Bay College in January this year, and I found what was really helpful to, you know, the beginning of our sort of coaching athlete relationship was to just sit him down and talk, like explain to him what my illness and what my cycle is, and how that affects me and impacts my training. And I, you know, outlined my goals very clearly to him, that, you know, I want to win at the Olympics like everyone else, but sometimes the work that I do is going to look a little bit different to other people. And it doesn't mean I'm not working as hard as them. It just means I need to do some different work. You know, some of the suggestions that Alex made is the things that I focus on in my training when I can't do that, you know, heavy, intense load during a flare up. And I just, you know, focus on what I can do. And I think my coach and the support staff around me, you know, they understand that. And I don't have to feel bad or guilty about not doing what everyone else around me is. I just, you know, focus on what I can do, and kind of just keep putting one foot in front of the other. And it's, you know, even though you can't work hard all the time with an illness like endometriosis or adenomyosis, just sort of keeping that consistency is really important. And having a coach that understands and supports what you're going through is really going to make all the difference in having that consistent workout routine, I think.
Yeah, absolutely. We might just switch. Sorry, Graham, go for it.
Can I just ask Alex? Alex, there's been mention of ligamentous damage. Do you have many patients in your practice that have Ehlers-Danlos syndrome? Because all of my Ehlers-Danlos syndrome also have adeno. I've got about a dozen, which isn't a heap, but there are articles on endo, adeno, and Ehlers-Danlos syndrome. And I wonder whether we should think about that as well, like you and me, rather than the athletes. But do you have that? Do you see that?
Yeah, I think we definitely see there is a proportion of patients that have Ehlers-Danlos, and we do see them presenting in different pain presentations as well. So we don't probably have the detail to understand Ehlers-Danlos, but we could also expand it to general hypermobility as well. That if we're looking at those groups, they may actually be more prone to pain being a receptor, because the joint itself doesn't have that stiffness. We do see it in the populations of endometriosis. I'm not sure if one does link to the other as far as causation, but I think we keep it in mind that I'd be then more concerned about the risk of injury. And it does make it really hard if we're getting deconditioned. And as you know, if anyone's had endo, those times where you literally are bedbound and can't get up, and that becomes quite a cyclical effect of becoming deconditioned, that won't help. And, you know, that makes Ehlers-Danlos more prone to causing injury. So I think in the athletic population and the endo population, we do see it, but I don't know if we see it being everyone. And I don't think there's...
It won't be everyone.
study on that.
No, it won't be everyone. I don't want to say too much, but it is a genetic condition, and
Yeah.
you think about it and then get the genetic test done if you're getting
Yeah.
dislocations or you know, injury to joints, etc., etc. You know, I think that's not the scope of this talk, but it's interesting to hear what you said.
That's an action for you too after this session, guys. We might move away from the pelvis and up into the gut, and get into some nutrition and gut talk. Kellie, I'm really keen to know about your practice and managing diet and performance, and then layering on that endometriosis, which can be really tricky to manage. What do you tell us about your experience?
Yeah, sure. So I won't pretend that my practice sits within you know, managing symptoms within endometriosis. So the key area I'm working with athletes around is improving performance through improving health and performance through the use of you know, nutrition strategies that are well matched to the sports that they work in. So however, within my work, so I work at the Queensland Academy of Sport. I also work for the Sunshine Coast Lightning, who are playing right now. So yep. So and through working with athletes, I guess I have come into contact with athletes who have endometriosis. So I sort of didn't go out seeking that to be a specialty area, and it is probably still obviously a small part of the total number of athletes that I work with. But I guess it's about trying to optimise their athlete's diet and matching their needs to the sport, to the training program, to the phase of training block that they're in, while also trying to symptom manage some of the nutrition related, I guess, things that we know can play a part with endometriosis. So I have, as well as working with Maddie and Mon, I do work with a range of other athletes in different sports, and not one of their approaches, not even Maddie and Mon's, are the same. So I think that's really important. There are certainly some overarching things that I will look at, and I'm sure Kiah will probably have similar things in maybe non-athlete population, but I'm looking at strategies around bowel symptom management for those who have those sorts of issues. And again, there'll be different triggers for different people, and therefore different management strategies for those people. And then looking at some overall, I guess, broad approaches with their diet around the use of anti-inflammatory style eating practices that are actually probably quite good for lots of athletes, not just those with endo, because obviously inflammatory responses are really high in many sports that we work with. So that's probably a strategy that is particularly important, both food and in some cases a supplemental strategy might be what we use with an athlete around inflammation. But yes, certainly particularly significant for athletes who are also managing their symptoms around endometriosis. One thing I just wanted to say earlier, and I hope it's okay, Maddie, to use an example that relates to you. We talked about getting to know your own cycle and understanding your own triggers, which, as I've said, are so different with each athlete that I work with. But really interesting for me was catching up with Maddie via Zoom, socially distancing, during the COVID break, where for a range of reasons and a range of interventions that had occurred immediately post, I guess, the postponement of the Olympics, but Maddie had a really good patch with some of her symptoms, and I think it's really important while we monitor what we think might flare our symptoms and what might be triggers for things going south. It was really interesting to sort of stop Maddie and go, hang on, let's work out what do we think might have also been part of this little purple patch that we can continue to include going forward. So Maddie noted that not having, sleeping a little bit later in the morning, for example, because her training was at home, so she didn't have the stress of the alarm going off or missing the alarm or running late. So so that was an interesting, non-nutrition, but that was a really interesting thing for Maddie to have noticed, that additional sleep and the lack of worry about that was probably something that was different about COVID. She noticed that being able to change the timing of her meals around, across the day was a little bit different during COVID. The opportunity to empty her bowels before she trained versus worrying about that when that was going to happen. So it was really, I think that was just the point that I wanted to make. So while we're typically monitoring for triggers and when things are not going well, there's quite often a flip side to that where we can learn, you know, some strategies that are actually really helpful for us, and making sure we're, I guess, keeping note of both of those, because both can be helpful for the practitioner that you might work with in managing some of those symptoms.
Yeah, absolutely, Kellie. And, you know, you talked on a few different strategies there, and we've got Kiah here, who is a nutritionist and a dietitian. Do you have any other additional strategies to add on to Kellie's suggestions?
Yeah, so I guess what I generally see is more so working with a lot of people with endo relating to kind of like their bowel symptoms. That seems like a quite a common thing, you know, whether that be abdominal pain, bloating, diarrhea, constipation. And I think we were talking about a bit before, is like food intolerances as well tend to go a bit of hand in hand with endo, which we don't fully understand why. Like a couple of reasons into why we tend to find a few like reoccurring symptoms with things like IBS, for example, like irritable bowel syndrome, which has those abdominal pain, bloating, constipation, and diarrhea with endo. We find those tend to work very similarly. And that's also because of things like you touched on earlier as well, things like visceral hypersensitivity, meaning that essentially there's a lot more pain involved in kind of that distension and the contraction of the organs, those visceral organs in the gut. And that also often is why, you know, people might have very mild endo, but their kind of pain can be quite higher. And also relating to things like prostaglandins as well, which are kind of like hormone-like compounds that get released from the endometrial tissue, and then these also can cause a lot of this pain, so abdominal pain, cramping, diarrhea. So when we think about endo, a lot of the stuff that we do is linked quite closely to the gut and more gut management. So it depends on what the symptoms that people are presenting with. So if you're kind of getting more that kind of constipation side of things, we might look at things like modifying your fiber type that you have in your diet. With that though, we find fiber in pretty much all of our plant-based foods. So, you know, fruits, vegetables, legumes, whole grains. Having too much fiber is not a good thing either. It takes a while to digest, but is quite good at constipation management, and especially a specific sort of fiber called insoluble fiber, which we find on the skins and seeds of fruit. So that essentially doesn't dissolve in water, kind of helps the body kind of push things through the bowel. And so that can be really useful in incorporating if you are kind of experiencing more of that constipation as the side of your endo. So that could even be things like, you know, eating more kiwi fruits with the skins on, which some people find a bit strange, but it is very, very good. Even things like incorporating more, you know, flax seeds as well into your diet, whether that be in smoothies or on oats or anything like that. Also another area is things like incorporating more like natural laxative style foods. So things like, you know, prune juice or pear juice as well, or eating prunes or pears. And that essentially can help that kind of movement through the gut if people are experiencing more that constipation side of things. If you're experiencing more diarrhea side of things, that's where we look at increasing a different sort of fiber, which is more like your soluble fiber, that also actually helps with constipation, but more so helps as a bulking agent to your stool. So that's another kind of common one. And I know these things generally flow through the menstrual cycle as well. So a lot of these strategies might actually be useful to align with your menstrual cycles too. So with that, we might be looking at things like incorporating fiber supplements, like things like psyllium husk, again, which can be mixed into oats or in smoothies, or adding more legumes like lentils or chickpeas into the diet, because they are really good sources of that soluble fiber too. Also, other sort of strategies non-related to that would be things like water. That's also hoping all the athletes drink enough water. Surely you guys would. And I work with a very general population, not as much athletes, and people definitely don't drink enough water. So definitely try and get that 2 liters or so a day. Small regular meals as well, especially if you're experiencing flare-up, can be really important, because again, that quantity, that's putting a large amount of pressure on your stomach. Again, that's in that abdominal cavity as well. Your body has to digest a lot of that. That's kind of very close to where our uterus is, and a lot of that endometriosis can also be around that area, and adenomyosis too. And also kind of really focusing on just like eating slowly as well. So that's something that I find that actually doesn't matter if you have endo, adeno, or you're just a general day-to-day person. I do believe everyone should start focusing on eating a little bit more slowly, focusing on that kind of mindful eating, because often leading kind of the busy lives that we do these days, we tend to not focus on our food as much and just kind of grab and go, which understandably, if you're an athlete, there's definitely going to be cases that is, you know, that's all you can do. But taking that time to really, you know, chew and sit and eat, because when we start to chew, we start to release some of our digestive enzymes, which really starts that initial stage of our kind of digestion in our mouth there. And so that's really important in that kind of digestive process too. And saying that, those are kind of some of the initial strategies that I work with clients. But if that kind of doesn't work, we tend to look often along the like low FODMAP diet pathway, which works for some people and doesn't work for others. Tends to have really good results with people with IBS. And so when people are cross-diagnosed with both, which honestly, I think people are sometimes cross-diagnosed with both because it's actually just endo, but the symptoms are very, very similar. But we often do find quite good improvements following a bit of a low FODMAP diet. So the FODMAPs, and I'm not going to go into any detail because it's very, very long, but as a small little summary, it's essentially a group of carbohydrates that get poorly digested in your gut. And essentially when they get into your large intestine, they sit there and they ferment. And that fermentation process causes a lot of gas from the fermentation process. And that can trigger things like abdominal pain, diarrhea, constipation, and the likes. And so, you know, with some of those symptoms found with endo, but also possibly as well as the IBS as well, if you have been cross-diagnosed, it tends to improve those symptoms a lot. But I'd always say it's quite a long restrictive diet. Always do it like with a professional as well, because it's definitely not something you want to be on for the rest of your life at all.
Bron, have you had any experience with trying to work with your diet and nutrition to help manage your endo?
Definitely. I've been on the low FODMAP for a little bit. It takes all the flavor out of everything. Yeah. But it was because I run the gauntlet a little bit with some of those symptoms. Like there's never one or the other. There's usually a mixture of both. And for me, it was really focusing on what I was intaking and getting that energy, but also, you know, you've got low iron and you've got low B12, and having to get all those nutrients in is really difficult. And then it's not something that I really enjoyed, but some of the things you were mentioning, like I eat so much slower than the rest of my teammates. When we're on tour, they're usually, you know, getting as much food as quickly as possible, and I'm there still like the last person every single time. And I'm really struggle on tour because we only get 3 meals a day generally, so having to fit in extra meals because I am a bit of a grazer, I eat smaller meals, and balancing that act. And I usually travel with half a suitcase of food because we go to places where you're not too sure, you can't get out, and you can't eat some of the stuff because of how it's farmed. So it's really, really difficult. I think nutrition is so difficult, especially when you're on tour and you lose some of that control. It makes it really tough.
Yeah, definitely. And I think what you said with iron, that's another really important point, just from like a nutritional point of view, is like, as females, we tend to have really quite high iron requirements because we are menstruating every month. And so the iron requirements for males is about 8 milligrams, and females, it almost doubles more than that. It's 18 milligrams a day. But that's just based on kind of like a normal menstrual cycle of, you know, just bleeding for a couple of days each month. But then again, if you compare that with a lot of the endo and adeno symptoms, which may also include.
Oh, I think we've lost you.
And so that's also another important consideration as well.
I do have a question. Does lactic acid form, because you obviously generate a lot and you maintain a lot and it takes a while to clear, does that play a part in any of on that nutrition side and that digestive side.
I think Kellie could probably answer that better than I could.
Yeah, probably not, Bron. I guess your ability to shuttle that build up of lactic acid back into the energy pathway, that happens pretty well and pretty easily. What I do find though is, particularly if you are doing, you know, your high lactate, you know, your threshold type sessions, is one of the things that can happen is appetite can get blunted. So in terms of I guess, wanting to eat soon after those types of sessions, often with athletes, they won't want to eat, which can interrupt recovery. But in terms of playing into some of the symptom management for endo, if you delay that recovery and therefore your next meal you are quite hungry and then you eat fast, a lot of food at once, those sorts of things, that's probably more likely to cause a bit of an issue. But I say that without knowing of any research in particular that's actually looked at, you know, lactic acid and symptoms, but that would be my off the cuff response for you.
Alex, were you going to jump in there?
I was just going on a similar note. Now, I'm not a nutritionist, but from an estrogen specific perspective, it seems to be related in substrate metabolism. So that's how our muscles develop and how they function. And I guess that comes back to what we might see and why we see changes throughout a cycle. So, you know, we've talked about that during a bleed. Well, our estrogen is really low, and leading into ovulation, that's sort of the peak of it. But both of those cases might be extremes for other people. So, you know, affecting that, the hormones do affect how our muscles and they synthesize energy as well.
I also just wanted to touch a little bit on certainly low iron is something that is often overlooked in young female athletes as well. I guess that generalised fatigue is very easily explained away with young athletes who are juggling school and training and those types of things. And certainly it's not something that is necessarily just done on a routine basis. Usually, you know, someone is displaying some symptoms before that is tested, and sometimes that can go for some time. So as Kiah mentioned, yeah, the requirements for iron for women are up around 18 milligrams, and we don't particularly absorb iron that well from the foods that we consume. So the daily requirements are 18 milligrams because ideally we'd like to really like to absorb about 1, if that gives you a little bit of an idea. And then when you look at menstrual losses, they can be up around 5 milligrams. So it's tough to absorb and easy to lose. So certainly, you know, female athletes, if you're feeling generally fatigued, but certainly if you combined with that having high menstrual losses, I would really encourage you to make that a topic of conversation that you have with your GP as well, to have that measured. You know, measured in the first instance, but if you've got some history of that being low, to continue to remind your doctor about that history so that can be continually monitored, because that can be quite debilitating, but it also can be somewhat, you know, once it's known and treated, you can, you know, an athlete can feel much better relatively quickly once those are corrected, just from the fatigue from iron point of view, not fatigue obviously for all the other reasons, but that's definitely something to keep in mind.
Yes. Could I just make another comment on diagnosis? So if a young female athlete has those symptoms, often what happens is they're sent along by the GP for an ultrasound scan, as you well know, and the scan is reported as being normal, right? And they're told, your scan's normal, therefore you're normal. That's not right. So the symptoms should be looked at rather than just a scan, because for changes to occur on scan, to be seen on scan by the generalist scanner, it's a late thing, right? Once you see endometriosis on scan or adenomyosis on scan, you probably almost missed the boat. So just for all the listeners, don't just rely on a normal scan means a normal pelvis, because it doesn't.
Absolutely. Belle, I do know that you need to head off, but can I just ask you a quick question? Can I be sneaky and ask you a question?
Yeah, of course.
about your, so, you know, you don't have diagnosed endometriosis, but you are a female in female athlete. Have you used your diet and nutrition to help your performance, and how have you managed that?
So I experimented with the gluten-free diet. It's funny because I always get people shit who went gluten-free diet. I did it after my knee injury, and that was because I had problems with inflammation. I'd get a ton of swelling in my knee and it'd get really sore and painful. It wouldn't perform the way I would want to. So I started researching on the Google and found that it's an inflammatory, and decided to, I guess, completely cut back on my on gluten, and no swelling, no soreness, nothing. So I traveled to Switzerland and there's some amazing bread there. So I do like to have some fresh bread when I'm in Switzerland, but I do go gluten-free when I need to, especially around competition where it's high intensity. You're putting, I guess, your body on the line, and you want to perform at your very best. So I'll go gluten-free for the whole week, and then add a little bit of gluten back into my diet, and then come back off it as well. I don't want to go full gluten-free, just because when you travel to so many different countries and weird places, you don't know what's in the food, and I don't really want to, I could be wrong, build up an intolerance to it. So yeah, part-time gluten-free.
I love that. Fantastic. Guys, I'm conscious of time, but I'm really keen to hear if some parting comments or final words. Do you have any strategies or take-home messages for the listeners to try and implement into their life? You know, we've talked a lot about a lot of different tools for people to add to their toolbox. We have people on here, whether they are in the in the athlete world with Kellie, or external. We have gynaes, but we also have some really amazing athletes that are online for people to come and talk to, and really discuss what's going on for them. So I'll kick it off with Maddie. Do you have any strategies or final tips that you would love to share?
Yeah, I guess I would just reiterate what Monique was saying before about just, you know, trusting yourself and how you feel, and trusting how an athlete is feeling and what they're telling you, what they're experiencing. And I guess just like you don't have to be really sick or starting from some type of deficit to want to feel better. You know, you don't have to have endometriosis or adenomyosis to want to, you know, improve things like your diet or tracking your cycle or communicating with your coach and stuff like that. And, you know, certainly can be really hard. Often the advice around, you know, feeling better for a lot of things like endo and adeno and things like depression and, you know, diabetes, a lot of the initial advice will be to, you know, eat better and sort of exercise more, which is sort of, you know, what we're all already doing as athletes. And so it can kind of feel hard to know, you know, what more can you be doing when you're sort of already exercising so much and eating quite well. But I hope this discussion tonight has sort of shown people, you know, and all the advice that's been given, it's shown people that there is more that you can do, and that if, you know, you don't have to be feeling sick to sort of want to get help and improve on those things, really.
Absolutely, Maddie. Thank you. Kellie, do you have any take-home strategies or tips?
Yeah, I think without the risk of sounding a little bit generic, I think we've heard lots of people's, I guess, takes and experiences, and I probably just want to reiterate that no two experiences will be the same. So certainly when you're looking, if you're you know, sub-elite, elite, or, you know, want to be an elite athlete, I would really encourage you to engage with an accredited practicing dietitian or sports dietitian before you play around too much with your diet, and certainly in the case of eliminating large food groups and things like that. So I just would be pretty cautious about just making sure you have the right, I guess it goes for the whole panel, having the right team around you and making sure that you're getting the best advice so that you're not sort of creating another problem in the process of trying to solve another. So I think engaging with the right people people and getting the best advice and finding what works for you. And that can be a little bit of a process. So being consistent and sticking with that is tip number one. And also, I know it's the theme in general, but be really open and honest about the symptoms that you're experiencing, so that the team around you, you know, the more you communicate to your might be your high performance team or your medical team, you just never know what little tidbit you let out that sort of triggers that thought to maybe take you in a direction that maybe you haven't thought of before, and that can lead to hopefully a better diagnosis or better outcome for you as well. So I think communication and being really open and honest with your team is really important.
Absolutely, Kellie, that's fantastic. Thank you for sharing that. Graham, do you have any strategies, take-home messages? I'm sure you do.
Yeah, look, this is an amazing group of women, yourself included, Jess, who are performing sometimes, you know, against the odds, and I congratulate all of them, and yourself too, for the work you do. For the other listeners, if you are having pain at period time and heavy periods, and you're needing time off, whether it be school or work or uni or training, wherever you might be in Australia or overseas, go find a gynaecologist, look on QENDO or similar endometriosis-friendly sites, and find a gynaecologist that's going to listen to you, or before you even get that, find a GP that's going to listen to you, because you don't want to go around 13 different doctors to finally get someone to say, oh, you might have endo. And sadly, a lot of patients are diagnosing themselves when the diagnosis should have been made years ago.
Yeah. Thank you, Graham. Alex, words of wisdom?
I think that we see a lot of people with pelvic pain, and I agree with what everyone said, that it is very individual, and your symptoms may include one organ. It might be the bladder, it might be the bowel, it might be pain, it might be your performance. And I think that we've got to keep in mind that if we don't talk to each other about it, or work out which symptoms you're suffering with, that we can't adjust treatments appropriately. I also think it takes that team approach, and I wish it didn't, because it would be easier if you had one person, a great GP who could manage it all. But I think with the complexities of athletics performance on top of a autoimmune and hormonally driven condition, that we do need to think really broadly. And in management, think of both conservative and medical, because we know that it's probably going to take both. It's going to take a nutrition approach. It's going to take timing and modifications. And it will take maybe one or two other professionals just to help guide where your symptoms are. And variability in your training, variability in how you approach your symptoms. So some will be managed with medication, maybe some are managed with nutrition advice, is definitely how we need to think in the long term about managing these persistent conditions.
Fantastic. Thank you, Alex. Bron, what are your strategies, take-home tips?
I think that communication piece is so important, because, you know, most of my sport is surrounded by men who are coaches, physiologists, run the program. And whenever you brought up your period or anything associated with that, they would just simply shut down, didn't want to hear about it. And it was just something that it's how society sort of ran at when I was growing up. So I think we started really small as a training group and just spoke about it amongst my training teammates and training partners and friends, and that sort of thing grew, and you sort of got an idea about, well, there's more than just me, it's a lot of other people, and that sort of became a group movement rather than one person going to a head coach, you know, in their 30s to 50s, who you'd mention your period and would go all red and embarrassed and not know where to look. And it just became awkward as a 16-17-year-old girl. So I think having that communication line is so important, and there's always strength in numbers. So talk to your teammates and your friends, and it's there, because once you get those communication lines open and working, it becomes so much easier and it becomes part of your day-to-day life.
Yeah, I love that. Get your women, get your girls around you and go in together. Fantastic. Well, can you imagine that coach? I don't think they would know what hit them.
No.
But that's fantastic. Kiah, what some strategies you've shared loads with us, but do you have any take-home messages?
I would say if you haven't looked at your diet yet from endo, definitely do it. Whether that's with a dietitian that understands endo, because not everyone does, or sports dietitian if you're definitely more sports focused. Because there's a lot of stuff we can do. Like we've just really I've kind of touched about more that gut health side of things and managing those bowel symptoms, but that's just a small piece of the puzzle. There's so many different things that we can do, like looking at more anti-inflammatory style diets, focusing more, limiting any sort of pro-inflammatory foods, looking at all your different vitamin and mineral levels, making sure you're not getting enough, or you're making sure you're not getting any vitamin deficiencies. So I definitely always say it's worthwhile to seek the help of a professional. That kind of goes for like what everyone's been talking about, that team approach. It's so important. But I guess, even in terms of testing, just, Graham talked about, scans being clear, and that's, that's it. From like a nutritional perspective, if we just look at like, say food allergies, there's like a lot of like unorthodox testing out there as well, especially so-called allergy testing that, you can spend hundreds of dollars on, and it's the results, there's just no scientific evidence behind it. So I'd always say, as much as it's great to go do Google research yourself, I definitely always say, kind of go see someone that specializes in the area of all your different kind of health professionals as well. That'd be my probably biggest take home.
Yeah, and if you are an athlete, working with your team within that community as well. Mon, you could talk underwater. I'm sure you do. Any take-home strategies?
I think we've shared so much information here tonight, and if you're feeling a bit like, oh, where do I start, head to QENDO.org. They've got amazing resources there, and also the newly launched QENDO app. You can start tracking your cycle, tracking your symptoms, you can track what you're eating. It's a really good place to start, to just start gathering that information. What took me so long to get anywhere was that I had a really irregular period, and I only had about 3 or 4 in 1 year at one point. So it was a really long time to get data that was so important. So places like QENDO are really, really great, fantastic up-to-date data. And the other thing would be, get talking to people. When I saw Graham, he helped me get in touch with Maddie. I then got in touch with Kellie at QAS, and it just sort of started this ripple effect. And every female who's an athlete, we've all got a uterus, we've all got some kind of experience with how that works. And if we start talking to each other, we start to realize, wow, I'm not alone. And hearing other people's stories was where I started to feel validated in my own experience. And that's when other girls on my para team specifically started talking to me as well. And I've sent Graham a few patients. I should probably get commission on those. But it's just been an amazing ripple effect. So start talking, and when you can talk to your friends and your mum or your sister, you'll start to get that confidence to talk to your own coach, and you can bring in support people with you. A lot of sports have wellbeing managers, or just go talk to whichever female staff member is on your team, and there's power in numbers, and you can work your way up to sitting your coach down and educating him the way that they've missed out their whole life. So thank you so much for joining us. This is amazing to be sharing this, because I wish I had this a few years ago when it all started for me. So good luck to everyone out there on their journey, and please stay in contact. We're here to help. We want to make that next experience just that much better.
And speaking of that, so thank you everyone for your strategies and tips. We do want to continue the conversation, and so I'm really excited to announce that we are launching tonight. It will be live by now, a particular athlete's corner. So there will be a specific forum that only female athletes or anyone working in the world of female athletes are accessible to. So the address is QENDO.org.au/athletes corner, and there is a discount code Athlete, ATHLETE, which you can access now. So that will, we will upload this video as a resource into that particular group, and we will be able to answer lots of the questions that have come through on the Q&A, as well as email, and we've been dinging all night. We've been receiving lots of DMs as well. So we'll continue that conversation, because as you've seen tonight, this is a learning opportunity. And when I spoke earlier in the session about creating a toolbox, this is one part for your toolbox, and you need to continue to learn and understand your body. And then as your body develops and changes, more information and resources to add there, so you can become empowered yourself. And you've got a wonderful group of female athletes and team around here to help you do that. So you are not alone, and we will be reaching out soon. Now, we will end it there, and I'll thank everyone for your time and for your interest. You will receive a survey, and if you complete that survey, you will go into the draw to win a few goodies. We have Pain and the Prejudice, which is written by Gabrielle, I think it's Gabrielle Jackson, which is a really, really good book. We have a few Modi Body vouchers, which are just, if you don't know what Modi Body is, head over. They are amazing. They even have swimwear. And we also have a book that has been written by Dr. Graham Tronc, who has been on the panel tonight, and a few others have supported some writing, some chapters in there as well. So it's a really great tool to add. So, you know, Tokyo 2021 is coming up. I hope that you have been able to find some really great pieces of information and strategies. But if you are stuck, do know that we are here, and head over to the Athletes Corner on QENDO, and we can continue this conversation and continue supporting each other. Thank you, Mon, for being in a wonderful model down there. And we'll talk with you all soon. Thank you so much for coming.